name is Bianca Chan. I was from the class of 2011. Before I started, I did a pre-med degree in the UK. Then I took some time off to do some research in the US and some volunteering work in Nepal. And then finally started medical school in Duke-NUS. Yeah. I guess the first decision was whether to do adult internal medicine or to work with children in pediatrics. And it was actually a very difficult decision for me to make because I had always wanted to do internal medicine. And even throughout medical school, pediatrics never really featured very much in my decision making. It was only in my final year when I had to sit down and ask myself what I ultimately wanted to do and where I saw myself in the long term, that I sort of had to sit down and think about whether I would be more able to contribute more by doing pediatrics. So in the end, I finally decided that I think I would be able to make more of a difference in the life of a child than I would in the life of an adult, because a lot of the time for adults, there's very little you can really do for them. And there was always this agonizing about how far to go and how much to do. Whereas for children, there's less to think about. You just go all the way, you do whatever you can for the child. And I think ultimately also, I hope to use the work that I do to help in mission work in developing countries. And I felt that doing pediatrics would equip me with the skills to help the children in a lot of these countries. And so, I finally decided to do pediatrics, and I'm very glad that I did, because as I did my housemanship both in adult internal medicine and my housemanship in pediatrics, it made me realize that I really enjoy the work in pediatrics a lot more. It's a small department, people are very nice, and they do hold everybody to a certain standard. So you have to work very hard, but at least you feel that there is a certain standard that you have to achieve, and you feel that you're improving each day as you grow. And I really enjoyed interacting with the children, because it's something where you go to work and no matter how difficult the work is or how tired you are, you see a child and you can't help but smile. I enjoyed educating the parents and helping them to feel less stressed and less anxious by helping them to understand why the child was sick and why things were happening that way. So ultimately, I realized that I found pediatrics very fulfilling for myself. Initially, I was thinking about whether to go to the US or to do it in Singapore, and then within Singapore, whether to do it at NUH or to do it at SingHealth. And ultimately, I decided to stay in Singapore because this is where my family is, this is where my friends are, and especially at the start of your working life as a doctor, it is a very difficult period. And so having the friends and the family and having that kind of support was very helpful for me. And in the long term, the friendships that you make and the bonds that you make at work as well were very important to me. And then in terms of where in Singapore to do the residency, KK is one of the biggest, it is the biggest children's hospital in Singapore. And there are, you see a lot of different cases and just a lot of different patients that come through the doors of KK. And I felt that I wanted to learn by doing and by seeing patients, such that it became something that was something that I became so familiar with as part of my everyday work. And it would be more than a theoretical idea from a book. And so that's why I'm in KK. Yeah. Because we were the first batch, there was a much smaller batch, and in that sense, I think I wasn't really that anxious about where I was, because I believe that ultimately I just let God decide. But I was glad that I got my first choice, which was to do pediatrics in KK, and I was just glad that I got what I wanted. Yeah. I think the main difference is that now you're working instead of studying. And work is very different from studying. So when you're a student, you have a lot of flexibility. So you do what you want when you want most of the time. You see, patients that you think are interesting. You see patients that you feel will facilitate your learning. However, when you are working, there is a certain daily routine that you have to go through. There is work that needs to be done. And you have to be professional, and you have to show care and concern for everybody that you come across, no matter how tired you are, how hungry you are, and no matter whether this particular case is interesting or not. If it's your responsibility, you have to take care of everything. And you just have to do your best for every single patient under your care, whether you feel like it or not. So I think that's the biggest difference between being a student and being a resident. But the other side of it is that as a resident, it's very fulfilling because you are finally in a position where you're able to help somebody else. So you have the skills, you have the knowledge, and you're there all the time. So the students come in and they go, and they come in and go. But as a resident, you are there all the time. You're the primary person taking care of this patient. And so you are there making things happen. You're there to comfort them. You're there to help them to understand what's happening. And at the end of the day, when they finally walk out of the hospital, and all these little kids will go, "Bye-bye, doctor," and you just feel that sense of accomplishment, a sense of achievement that you've been able to help somebody. And I think that is something that's quite different from being a student when you don't really take ownership of a patient. Yeah. So I started my residency as a house officer. And so you have to go through basically housemanship like everybody else. And it was a tough time because you're basically struggling just to grasp the basics, learning about what needs to be done, how to do it, how to go about getting scans done, how to go about ordering things, what kind of medicines to prescribe. And you're doing a lot of the tedious day-to-day paperwork that needs to be done. Whereas in your second year of residency, in pediatrics, we rotate through different departments. So every month, I'm in a new department, learning something new. And I get to learn more about a specific area and to go really in depth into a certain kind of condition. And because you've already gone through that struggle of learning all the basics, so you have a better grasp of what's going on, and you don't struggle so much anymore. And you also get more exposure. You get to do presentations, you get to go for clinics, and even taking exams helps you to sit down and consolidate the information that you have learned. And so in general, the second year is much better than the first year, and it's a lot more enjoyable. But I think it only happens that way after you've gone through the pain of the first year. Yeah. My time at Duke-NUS was very good. And I feel very blessed to have been able to come through Duke-NUS. The emphasis on problem-based learning rather than simply fact memorization, I think helped me a lot. Because right now, I don't remember most of the facts that I read in the textbooks. But what I really remember, and even during my specialist exams, as I sit for the exams, I remember the problem-based learning that we did during class, during all the team leads. The scenarios that we had, the discussions, and the pearls of wisdom that the different professors would come and share with us. I remember how it was reading up about patients each time, reading up research articles to find out what is the best way of tackling a particular problem. We do a lot of presentations now as a resident. And having done those presentations during the clinical years as well helps you to learn how to present cases, how to read up about a topic, how to present a topic. And I think the hands-on during each rotation, where we were really embedded into the teams, and the SIP work that we did really helped make it easier to transition into housemanship. So there was less struggle because we already knew what needed to be done and how to do it. So the beginning was a lot less painful, I think. And then the electives that we had, that I was given an opportunity to do overseas and in Singapore, really helped me to understand more about each individual topic and how to go in depth. And so, yeah, I think in general, it was really very good preparation for my work as a resident. Yeah. Firstly, it's a lot of the choice about who is selected, I think, ultimately boils down to attitude as well. Because if you are really keen to learn, and if you are hardworking, if you are willing to put in the effort and to do a job well, it, I think, goes a long way in helping you to be a good resident and to do your work well. So I think, even the small things from in the first year, learning about each condition, doing your own reading properly, and then when you go into the clinical years in the wards, to really show that you're interested in learning, show that you're interested in what you're doing, and to have a good attitude and be nice to people. I think in general, those are the main things that people will look out for ultimately if you leave a good impression during your clinical years. In terms of choosing a residency, I think as you go through medical school, you have to be aware of what makes you happy. Which areas do you find fulfilling? So I found talking to people, explaining things very fulfilling. Some other people found, being able to do particular procedures very well, very fulfilling. And so it depends on where your gifts that God has given you and how they are able to be used ultimately when you're doing your work. Because I think the work is very different from studying a subject. So you might like a subject matter, but you really have to enjoy what you have to do at work day in and day out. And it's more than just a subject. It is about how you are going to be able to help people and how you will enjoy doing that, because that's the only way that you can do your work well, if you have passion for it and if you really enjoy doing it. After finishing residency and finishing all the exams, I'm planning to subspecialize. Which area, I'm still in the process of trying to figure out. But I think one thing that I have also learned in this past couple of months is that I really enjoy teaching, both teaching students and educating families. And so I hope to be doing more of that as well as part of my career after residency. In terms of research, I haven't really had much chance to do very much research. So it's something definitely that I'm still interested in doing, but that I will have to find out more about as I go along. And I think ultimately, I do want to use my skills to help people in developing countries to do mission work and to actually really make a difference to more people than what we have within our walls. And that is hopefully something that will happen when I've finally gotten the skills that I need to be able to be of use to somebody else. I'm very grateful to Duke-NUS for the education that they have given me, as well as the opportunities that they have given me during my time here, both in terms of the ability to do research, the ability to go overseas for my research as well as electives, the kind of exposure that we got, and the care that was shown to us by the individual faculty who were teaching us, and the mentoring that I've had with a lot of our faculty. So I'm very proud to be an alumni. I'm very grateful to be an alumni, and I suppose once you've been part of Duke-NUS, you will always be part of Duke-NUS. Yeah. It depends on what you want and sort of where you see yourself in the long term, as well as what you want to get out of your medical school education. It's not easy, but at the same time, nothing worth doing is ever easy. But yeah, I mean, just go for it.